So now I took my pregnancy test and I know I'm pregnant. And I think the next thought, and of course, the next concern is this going to carry through? Or could I have a miscarriage? And if so, what are those warning signs?
Sure. The most common warning sign of miscarriage is some bleeding and some associated bleeding. And once again, it gets a little confusing because bleeding can occur even in a normal pregnancy. But bleeding that is associated with some cramping, it's increasing in intensity. That's one of the earlier signs. But I caution patients not to overread into those signs because, as I mentioned, it happens in a lot of early pregnancies. The other sign is that, the fullness in the breast, the things that we typically associate with pregnancy, the things that makes a patient go do that pregnancy test, it's just not progressing as much. And in fact, the patient feels my breasts aren't as full. I'm not as squeezy as I was before. Those are some of the earlier signs of the pregnancy, maybe not completing it. We call it failed pregnancy. So those are some of the things that you watch out for. But I want to take you one step back, if I may. And I think the most important criteria in terms of miscarriages or not miscarriages is getting yourself ready for the pregnancy before you even start planning for a pregnancy. I think that pre-pregnancy planning is critically important. You want to get yourself in the best shape you possibly can, get rid of some of those bad habits, the smoking and things of that nature. If there's a little bit of a dietary issue, if you want to drop a few pounds, that's the best time to do is before you get pregnant, not after the pregnancy. Once the pregnancy has occurred and you're dealing with the pregnancy is going to continue or not, the unfortunate reality is that Mother Nature is not a very efficient sustainer of pregnancies, and about 1 out of 5 or 6 pregnancies, unfortunately, will end in a loss of that pregnancy. So it's a fairly common occurrence. One of the things that I mentioned to patients, and I think it's a very critical point, the most common thing the patient feels when, unfortunately, a pregnancy does not continue is, what did I do to cause this? How could I have prevented it? And the reality is, in most cases, you cannot prevent it. And in most cases, I try to alleviate the patient's sense of guilt, if you will, by telling her there's really nothing that you could or could not have done, and there's nothing that you did that caused this. Whether staying off your feet or not lifting that extra bag of groceries, that probably did not cause the miscarriage if it is going to occur. But so that sort of take a step back a little bit and look at the whole picture.